Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She is the CU PhD administrator. Julie, it's been a couple of weeks since the mask mandates have kind of changed. Have we seen a spike in numbers, or are we holding steady at a downward spiral?
No, we've actually seen an increase in vaccination, which is good. And that means that, people are wanting to be able to get out there and go unmasked and do it safely. So I find that encouraging. No, our numbers are holding steady, which is a lot lower, and we're very thankful for that.
At least 25 states plus Washington, D.C. have fully vaccinated at least half of their adults. However, as I look over the list, Illinois is not on that list.
Mm-hmm.
We're doing so well in our community. Why not Illinois?
Illinois is a very big and diverse state. So you can imagine that just as some places did not do as well, you can look at it county by county and you can see that certain counties are well on the way to meeting that mark. Certainly we're over that mark already. We're getting there in other parts of the state. But, it's going to be the same kind of thing where people weren't following the other guidance. So I doubt that they'll be getting vaccinated, some of them. And it's unfortunate too, because we're going to see this continued spread, and we're going to continue to see hospitalizations and deaths in places where they cannot get up to a high enough vaccination rate.
Have we seen the desire and the demand for vaccines slow down in this community?
It's slowed down, but it hasn't, completely dropped off. We're still doing, in this community, we're still doing vaccination every day, which is great. I mean, it's not the big push we had at the beginning, but we're just encouraging people to get in there and get it done now. One of the things that I keep hearing from people is, well, I just want to wait and see how other people have done. Well, in our community, we started vaccinating in January, and we're up to 183,432 doses provided in our county alone. So there's really nothing to wait for. You need to get out there and get it before you end up catching, COVID. And like I said, we're still seeing deaths, and we just had we're seeing hospitalizations still, and we had another death last week. So it's just really important for people to get it done. Don't wait around. Don't wait till fall. Get it done as soon as you can do it.
Let's talk about the numbers now. Hospitalizations, recoveries, deaths. Let's go over those numbers.
Let's see. Right now we're up to 240 cases that are in isolation, 305 in quarantine. There are currently 8 people from Champaign County who are hospitalized. We've had 148 deaths. Our positivity rate for our county, excluding U of I, is 2.7%. And vaccination numbers, those are looking a lot better. We're at 52.98% of the county that has had at least one vaccination. So that's counting people that are yet to go back for their second because they're not due yet. 47.07% are fully vaccinated, and that's 86,297. So, I think that is very encouraging. And also 84.54% of seniors 65 and older have been vaccinated. But as I posted on Facebook today, that still leaves a little over 4,000 people in our county who are 65 and older and not yet vaccinated and very vulnerable.
Have you found that the people that started out super resistant to wanting the vaccine, is there a magic thing you can say or do to get them to change their mind?
No, if there were, I would have already done that, but no. So usually there's just, there is a group that will never take it. They're just not going to take it. But there's a whole another group who are doing various things, various calculations, in their head. I usually encourage them to talk to their healthcare provider, if they have questions about their specific situation. There's a lot of people who are afraid that if they have allergies, that they can't get vaccinated. That is just for people who have allergies to very specific ingredients in the ingredients in the vaccine. It's not any allergies at all. The other thing is, what are some of the other things that we hear? People are concerned that they've already had COVID, therefore they don't need the vaccine. They do. Go ahead and get that, even if you've had COVID. And those are the main things. It's mostly just individual we're down now to the point where there's a lot of just individual concerns. We're happy to answer any questions we can help answer. Otherwise, contact a healthcare provider. If it happens to be some other type of, concern, like if it's something that has to do with your religion, contact somebody there. So we just need to see people vaccinated.
Well, I just saw today on social media that anyone 12 and up can go to a walk-in clinic. Can you talk about where that is and some of the hours for those?
Yep. I mean, if you go to vaccines.gov, you'll find all the vaccine we have in the community, what type it is, where you can get it, hours, if you need an appointment, if it's just walk-in. But, we have walk-in clinics here on Fridays. We have OSF is still doing vaccinations. The Carl's doing vaccinations. Promise Healthcare is doing vaccinations. Christie's doing vaccination. Everybody's still vaccinating. And on top of that, you can go to any Walgreens, any CVS, any Walmart, and just walk into the pharmacy and, or look online and see if you need an appointment and just do it. They're all no out-of-pocket cost, and anyone can go to any of them. So, don't wait around for somebody to come to you. Get out there and do it. And meanwhile, we're still doing lots of clinics. We did a clinic at Salem Baptist Church in the parking lot with NAACP this weekend. There was one at St. Mary's over in Urbana. There was one at Carriage Estates, I believe it's called. And so we're continuing, just pretty much 7 days a week you can get vaccinated in this county.
While you're answering questions, here's a really big one that I hear a lot and that I read a lot. I'm vaccinated, you're vaccinated, but we have little people in our lives who are important, people that are 12 and under. So can we love on them safely? Do we need to wear a mask? Do they need to wear a mask? What are the protocols?
Vaccinated people are fine to be around the kids. They're not going to give it to the kids. They're not going to catch it from the kids. So the main thing would be if you were getting a bunch of unvaccinated kids together, or there were unvaccinated adults in the group too, then you need to do any unvaccinated people really do need to do the same things that they're doing, or that they've been told to do, since the beginning of this, which is masking and distancing.
The measles parties and the chickenpox parties of the 70s and 80s, those are a terrible idea for COVID, right?
That's a terrible idea for measles or mumps or any vaccine preventable disease, including COVID. Yes, that is a terrible idea.
I always ask you questions that you don't necessarily have the answer to because no one does. You'd have to look into your magic 8-ball. Do you suppose, Dr. Fauci says we might need a booster? I'm assuming your staff has already planned for that. If one day they come out and say a year after your first shot, you need a second one.
Yeah.
What are the words on?
Yeah, we look for this to be, ongoing. One of the things that we hope to do here is to, get another mobile unit that we'll be able to take out, and because ours is getting a little ratty, so do that. Continue to work with our community partners. People will be able to get them at their, probably all the same places that they're able to get them now. But with the booster clinic, one good thing about a booster clinic is we would be able to have drive-through clinics, because that would not require the 15-minute wait. So that's a good thing. So that would speed things up.
This weekend, I saw an interview with a public health director in California. Julie, I don't think that a lot of people realize how much grief that people in your position get with the civil liberties and don't tell me what to do with my body, and how taxing has this been, and how much vitriol do you absorb from people in the community that don't think that your motives are on the up and up?
Well, I get a lot of it, but I don't absorb any of it. So it literally, bounces off of me. I continue to just do my job. This is a job that, I always do. We don't listen to, we're not about being a popularity contest. There's a reason why public health administrators are hired, not elected, because we just have to keep doing what we need to be doing. in this situation, the point is to protect our healthcare system and save lives. And we just have to keep doing what we know that we need to do, because when it gets down to, the end of the day, I have to be able to sleep and my staff have to be able to sleep. So we're going to just continue to follow the science and do what we know needs to be done.
12 and up right now, any vaccine clinic, many of them have walk-ins. Give the address again online in order to look up where your closest clinic is.
Sure, www.vaccines.gov. And you can look at them. If you happen to be out of town and you decide, oh, today's the day I want to get my vaccine, then you can look there and go get it. So and we're getting to the point now, of course, where we're down to trying to really make it as convenient as possible. We have plenty of vaccine in our community, and in fact, in the entire United States. We are very, very lucky. I don't think everyone understands how lucky that we are in this country. But with that said, the vaccine sitting in the refrigerator at my facility is not protecting anyone. Unless people take the vaccine, it's not going to be protective at all. So but we will get to a point where we will have vaccinated everybody who possibly wants it. And then the ones who don't have it won't be protected, and there won't be really, we will get to that point. We know we can't get 100% vaccination. That has never happened and never will happen.
But our goal is to get as many people right now, 12 and up.
Absolutely. And hopefully by fall, we'll be able to start vaccinating kids as well, because, that weighs very heavily on families. I get comments all the time. And I know, being a parent, and I went out and I got vaccinated, and there was a great deal of guilt, associated with me being able to get the vaccine when my family wasn't able to get the vaccine. And that's been throughout this pandemic because of the way it has to be, unfortunately. And there was it was a little bit different during H1N1 because the kids were the first to be vaccinated there. And, every parent wants to protect their kids. That's in our DNA. So when we get vaccinated first, that's an uncomfortable feeling. So, and I know that there are a lot of parents who are getting vaccinated to protect their kids until their kids can get vaccinated.
And someone explained it to me like the old motto on an airplane: if you're going to hit turbulence, make sure you have your seatbelt on or your life jacket, and then take care of your children. So I guess we have that to model after.
Yep. Because vaccinated parents cannot pass it on to their kids. So that at least that's important.
That's a start.
That's a start.
Leggett, our amazing producer, UPTV, our great partner, as well as Diane Marlin. She is the mayor of Urbana, and Julie Pryde. I know this is our 63rd show. We'll do this as many times as people need information. Thank you for being a wonderful partner in all of this.
Thank you.